ADHD stands for Attention Deficit Hyperactivity Disorder. It's a developmental impairment of the brain's executive functions. People with the disorder having trouble with impulse control, focusing, and organization. Neuroscience, brain imaging, and clinical research tell us a few things. That it's not a behavior disorder, it's not a special learning disability, it's instead a developmental impairment of the brain's self-management system. Both children and adults can be diagnosed with it. Patients and clinicians describe the disorder as iceberg because most symptoms lay hiding under the surface. The core symptoms of ADHD are first described by George Frederick Still, a British pediatrician, in a lecture series at the Royal Capital of Physicians. He observed that the group of 20 behaviorally disturbed children were easily distractible, inattentive, and unable to focus for long. He noted that the symptoms were mere common to boys and seemed unrelated to intelligence or home environment.
There are three causes of ADHD symptoms: genetics, biology, and chemistry. Learning about these causes can help you understand that your son or daughter is not doing these behaviors intentionally. Causes of ADHD: brain injury, exposure to environmental risk, or lead during pregnancy or at a young age. Alcohol and tobacco use during pregnancy, premature delivery, low birth weight. Symptoms: impulsiveness, disorganization, and problems prioritizing, poor time management skills, problems focusing on a task, trouble multitasking, excessive activity or restlessness, poor planning, low frustration tolerance.
Standard treatments for attention deficit hyperactivity disorder or ADHD includes medication, behavior therapy, counseling, and education services. Medication for ADHD is more effective when combined with other treatments. These treatments can relieve many of the symptoms of ADHD, but they don't cure it at all. Behavioral therapy, or also known as behavior modification, has been shown to be a very successful treatment for children with ADHD. ADHD can't be prevented or cured, but spotting it early plus having a good treatment and educational plan can help a child or adult with ADHD management and their symptoms. Exercise and spending time outdoors are some of the most positive and efficient way to reduce hyperactivity and inattention from ADHD.
People with ADHD have more dopamine transmitters than normal. What this means is that when dopamine is released into the brain, the transmitter transmits the chemicals too fast, resulting in the effect of dopamine happening faster and more intensely rather than less intense over a long period of time. Due to this link with dopamine and ADHD, the most widely used treatments for the conditions are stimulant drugs. Stimulants are specifically used to treat ADHD due to their effects on dopamine levels, which in turn affect attention. The stimulants increase the availability of dopamine in the brain, which keeps it from being exhausted too quickly. Due to this principle, antidepressants are often used as an alternative treatment for ADHD due to their own effects on dopamine levels. The link between dopamine and ADHD can produce some unexpected results due to the strong behavioral influence of the chemical.
In conclusion, attention deficit hyperactivity disorder is a common disorder that affects children and people of all ages. Within the first 5 years of child's life, this disorder appears. Medication can be given to a child once they have passed the preschool age. Depending on the type of medication, the effects can start within hours or weeks. Children with ADHD are often restless in daily activities, which can make acquiring an education difficult. There may be a link between this illness and family heredity. ADHD has a number of medical implications in children's development. Children with attention deficit hyperactivity disorder may require more positive reinforcement than negative reinforcement. They have to live their lives adjusting to timetables, keeping journals or notes, and constantly providing reminders for themselves to handle everyday routines. ADHD is a lifelong illness that affects an increasing number of children every day. Parents and counselors are attempting to identify the best way to understand and treat this disorder.